Welcome to today's webinar, Constant Therapy, a complete guide to implementing in a clinical practice. My name is Emily De Oliveira, and I'm a speech-language pathologist from the Learning Corp, and I'd like to thank everyone for joining this course. For speaker disclosures, I am an employee of the Learning Corp, the creator of Constant Therapy, and I have no relevant non-financial relationships. For course content, this course will focus solely on Constant Therapy and Constant Therapy Clinician, and it will not discuss other products or services. Here's today's agenda. We'll first go over the research on Constant Therapy, then we'll go over a comprehensive demo looking at different patient profiles, and finally, frequently asked questions. If you have additional questions or comments, you can contact us anytime at support@constanttherapy.com. So first, to introduce the programs, there are two separate apps for clients and clinicians. The pink one there is Constant Therapy Clinician. In this app, clinicians can have all of their clients under their clinician account, and they can access the therapy exercises, make changes to their home programs, and use the robust reporting. The white app is Constant Therapy. This is for your clients to use as homework between sessions or for continued practice when they finish with therapy. We're going to take a deep dive into these apps in the demo shortly. Now let's look at the research. All of the exercises in Constant Therapy Clinician and Constant Therapy are evidence-based. They're exercises you've read about in the literature or that you've seen in speech therapy workbooks or on your computer or in the clinic speech therapy closet. But now they're all digitized and in one place for you. And unlike paper-based workbooks, you can very easily vary the difficulty levels and you won't run out of stimuli or items to give. We won't be looking at the research on individual exercises today, but if you're interested, you can find this information on our website. Instead, we'll be looking at research on Constant Therapy as a whole program. The complete list of research is available on our website at thelearningcorp.com, and I'll be highlighting some research today. The first study we'll look at was published in 2015 out of Boston University. They looked at outcomes for individuals in the chronic phase of recovery. This study had 51 individuals with a stroke or traumatic brain injury, and they participated in a 10-week study. The control group got an in-clinic visit once per week, and the experimental group got an in-clinic visit once per week, plus they were given Constant Therapy as a home program. The home program users weren't given requirements about how long they should be spending on the program, so it was up to them about how much time they wanted to use the program. So as far as results, let's first look at engagement. Although Constant Therapy users weren't required to use it, they used it on average 4 hours per week. So that was 4 times more opportunity to practice the speech, language, and cognitive skills. And then looking at outcomes, within the app, the experimental group showed greater accuracy and latency on exercises. Outside of the app, the experimental group also showed more significant positive changes on standardized tests, and that was the Western Aphasia Battery and the Cognitive Linguistic Quick Test. You can see the p-values highlighted in yellow. So the study we just looked at involved individuals in the chronic phase in the outpatient setting. Let's switch gears and look at an inpatient study. These researchers wrote about one problem in the inpatient setting, which is the amount of downtime that inpatients have when they're not in skilled therapy. The authors wrote, in a 14-day period following a stroke, patients spend over 50% of their time resting in bed and 60% of their time alone. So this prompted them to conduct a study to see if it's feasible for inpatients to use a tablet between sessions to supplement their skilled therapy. They looked at 30 inpatients with stroke who had mild to moderate deficits in speech, language, or communication skills. The average length of stay was 19.5 days, and the average days using the iPad was 10. So these individuals were given an iPad that they could use during their downtime. The iPads were loaded with a few different speech, language, and cognitive apps, including Constant Therapy. It was recommended that subjects do at least 1 hour per day on the tablet, and 83% of those subjects met that recommendation. The average usage of the tablet was actually higher though. It was about 150 minutes per day. And also, interestingly, the level of engagement was the highest between 12 to 8 p.m., where about half of that time frame is outside when skilled therapy sessions are often scheduled. And this graph is showing the individual level of engagement. So remember, the average amount of time was about 150 minutes for 25 out of 30 participants. But there was also a range where some people spent much more time and some people spent less time. One trend with the individuals who didn't use the device the recommended amount of time was that it appeared fatigue, cognitive impairment, and the diagnosis of dysarthria seemed to be barriers for these individuals. And looking at people who spent greater than 5 hours on the iPad, as far as severity and prior knowledge of the device, there was quite a range in level. And when looking across the two usage groups, it doesn't appear that age, severity level, or knowledge of a device predicts how much a patient will use it. So that's one important consideration to keep in mind, that these aren't necessarily predictive characteristics to whether someone will be successful with using that technology or not. And so in conclusion, here's a quote from the authors. They said, "This acute care downtime provides an opportunity for targeted rehabilitation interventions using mobile platform technologies that can be utilized in wardrooms without supervision or additional healthcare personnel." So the authors found that using the iPad is feasible for these inpatients, and that's also prompted them to start recruiting for a larger scale study. So we're excited to see the outcomes of that. So those were some examples of prospective studies that have been conducted, and now I'd like to share some retrospective data published by the Learning Corp. We studied usage trends from 3,686 patients with stroke over a 4-year period. We looked at two groups, people who only used constant therapy in the clinic versus those who only used constant therapy at home. We wanted to understand how long it would take a user who was initially struggling with an exercise, meaning that they were getting less than 60% accuracy, to master an exercise, which means they were getting greater than 90% accuracy. What we found was that there were no significant differences in the number of items needed to progress between the two groups. Both groups needed about the same amount of practice to progress. But if you look at the number of days of engagement, in-clinic users were practicing about every 5 days, whereas the home users were practicing about every 2 days. So the home users were practicing more and therefore progressing faster in the app. And you can see this in examples shown in the table. It shows the median number of days between sessions by exercise with the difference in days in that last column. And this chart is showing the average number of days needed to master a task. The in-clinic users were just about 14 days and the home users were just about 7 days. And also to comment on other factors like chronicity and age, the analysis found that patients were still making improvements to their functioning as much as 2 years after the stroke, and nearly a third of the users were aged 71 and over. Here's a second retrospective analysis that's to be published in the JMIR. It's called Closing the Digital Divide, a cohort study of the enablers and barriers to using technology for speech and language therapy. In this analysis, we looked at 2,850 people with stroke or traumatic brain injury. And what we wanted to understand was, were there any patient characteristics that were correlated with more or less therapeutic engagement with the Constant Therapy app? So the user characteristics we examined were age, gender, diagnosis, time post-onset, and geographic location in terms of rural versus urban locations. And we measured therapeutic engagement in 3 ways: the total number of sessions, the days per week they used the app, and the total number of sessions in the first 20 weeks. Here's some of the descriptive statistics. There were 3 age groups examined. Females made up about 42% of the sample. People in the chronic phase made up about 59% of the sample. Stroke diagnosis made up about 77%, and then people in the rural location only made up 7.93%, which is interesting. There were significantly more urban users in the sample. The pink map shows the number of users per state, and interestingly, you can see there tends to be more users on the coastal states. And then the purple map shows the users in rural areas. So the inverse would be the amount of urban users. And here are some of the findings from the study. As far as age, while all age groups were active, contrary to known barriers of technological adoption, the older users who were aged 51 to 70 completed more therapy sessions during their first 20 weeks of access to constant therapy than the younger users who were 50 years of age or younger. For geography, patients living in a rural area completed more therapeutic sessions than those living in an urban setting during their first 20 weeks of usage. And this was an interesting finding because if you recall, there were much less rural users accessing the program. And this is pretty consistent with a lot of the literature that examines disparities in healthcare access in rural America. There's a great paper by Dutha et al. In 2015 who wrote about how there's 51 million Americans living in rural America, but they have their own unique barriers to accessing healthcare. And so, while not everyone in rural America experiences these barriers discussed in the paper talk about cultural perceptions, online services, getting to the doctor, or absence of services. And so I just want to take a moment to expand upon this. As far as cultural perceptions, Dutha et al. Talk about how healthcare providers are often viewed as community members, friends, or neighbors, and so there can be some concern around sharing confidential healthcare information. As far as online services, it's often discussed that digital health technologies have revolutionized healthcare delivery. However, in rural areas, there might not be access to internet or other devices, and so you either don't know what's available or you do know, but you still can't access it. And so that can make the healthcare divide even greater. As far as getting to the doctor, transportation can certainly be a challenge, especially in areas that don't have public transportation. And then as far as absence of services, the paper talks about how in rural areas there is a higher incidence of trauma center closures, where in 2015, only 24% of rural areas had a trauma center within a 10-mile radius, versus 71% in urban areas. And also across 34 states, 75% of assisted living facilities for the elderly were located in urban rather than rural areas. So going back to this paper's findings, these barriers could be contributing to the lower number of rural users. But interestingly, what this paper found was that once the rural users did access constant therapy, they were significantly more active. So this could be a good solution for these individuals to access and practice. Another interesting finding was that this group of rural users had much more self-signups. So they were finding constant therapy on their own, either through an internet search or an app store search, rather than being told about the program by a clinician. Looking at chronicity, we found that acute users completed more active days per week than chronic users, but chronic users' duration of therapy was much longer. And it could be that chronic users have incorporated this into their routine at a frequency that's realistic to do on a long-term basis. Then looking at diagnosis and gender, there were no difference on these activity metrics, so both genders as well as TBI versus stroke didn't show differences in therapeutic engagement. And then finally, the average patient in this retrospective analysis completed 37 therapy sessions during a 20-week period, which tends to be much more than a typical patient in the clinical setting. So the overall takeaway from this study is that there were some groups that used constant therapy more than others, but all groups were active in using the program. And digital therapies can be one solution to supplement the intensity and frequency of therapy and lower some of the barriers to accessing therapy on an ongoing basis. We're going to conclude the research portion looking at two different case studies that have been published. So this first one is a 71-year-old male with global aphasia who is in the chronic phase of recovery. He participated in speech-language therapy 1 time per week, and during therapy, he used constant therapy as a home program tool to increase his intensity and frequency of practice. And he showed good gains, and so when he was discharged, he continued to use the program and progressed to more challenging exercises over time. There's actually a part 2 to this case study. So if you look at the screenshot, this is our old interface, and you'll see in the demo that there is an updated look and feel. You can see that there is a graph of activity in this person's screen, and he was working on the app quite consistently, but then in April, there is a significant drop in his performance. And here are two specific examples, one language and one cognitive, of that steep decline in performance. So this prompted his wife to take him to the doctor, and a repeat MRI shows that there's two infarcts, the chronic left posterior parietal infarct and then a new acute left frontal infarct. And so this repeat MRI revealed a second stroke. Following this diagnosis, he returned to therapy and exercises were adjusted for his new baseline level, and so he continued to get speech therapy for some time, and then was discharged a second time and then continued on with using constant therapy at home. So there's several takeaways from this case study. One is longitudinal data. So the decline in performance was detected first by constant therapy before that diagnosis of the second stroke, and that was because all of that data was available to the patient and the family members. It also resulted in increased engagement. Accessing the constant therapy program resulted in consistent home practice, not only during therapy, but after therapy was over. And finally, functional gains. The family reported an overall improvement in the social and functional communication over the course of the year. Now let's look at a different patient profile. This is a 83-year-old female. She has moderate dementia and moderate severe cognitive linguistic decline, and she was residing in a special care memory unit. Here are some examples of her long-term goals, short-term objectives, and the SLP therapy course. And so constant therapy was an integral part of this person's speech therapy program. Let's take a look at some of the exercises that were used in her treatment. In the first week, she was introduced to two different exercises. We have Find the Same Symbols, which is a visual selective attention task and also works on visuospatial skills and scanning. And also Remember the Right Card, where she has to remember that first card that you see there, the Queen of Diamonds, as she sees a series of cards. She must tap on that Queen of Diamonds every time she sees it. So that's working on sustained attention, disinhibition, and memory. In week 2, another exercise was introduced, Choose Which Direction. So this is a selective attention exercise where she has to ignore all those distractor symbols and then determine which direction that pink arrow is pointing. Then in week 3, some memory exercises were introduced. She was working on match pictures and match words. In week 4, she also worked on a different memory exercise called Repeat a Pattern. And in this one, she has to look at a pattern flash up on the screen, and then she has to recreate that pattern from memory. And so that's a great exercise for visual working memory and visuospatial processing. Now let's look at some of the outcomes. So on the screen, you'll see some quotes from the author. In terms of engagement and therapy, the author wrote, "The resident appreciated the self-oriented, customized, and challenging activities. She enjoyed the feeling of that high-tech tablet versus some of the lower-tech rudimentary materials available, and that she expressed that these exercises were personalized and related to her interests." In terms of reduction of adverse behaviors, the author wrote that the tasks had a perceptible calming and almost meditative effect, as she concentrated on each task without any interruptions, distractions, or complaints. For generalization, the author wrote about an experience in the noisy dining room. So the resident expressed frustration due to a noisy peer. The SLP counseled the resident to apply strategies used in the flanker task, which this exercise is now called Choose Which Direction, to ignore distractions and focus on the task of eating. She successfully selected her attention to the meal without showing signs or symptoms of agitation or frustration. And then the last goal was independence, and the author wrote that she showed increased independence in therapy, and she was consistently and appropriately participating in her ADLs. And so the outcome of this was that she was judged to be safe and appropriate to be transferred to a non-secured long-term care unit, and that provided considerably greater freedom for her. So that was a snapshot of some of the research that has been done on the constant therapy program. You can find the bibliography on our website, and there's also a downloadable PDF on the website as well that gives you a nice summary of all of the research that has been conducted. Now we're going to move on to the second part of this course, and that is a demo on constant therapy and constant therapy clinician. And this demo will be great for people who are just learning about constant therapy for the first time and are new users, as well as existing users and people who have been using the program for some time. To give you an idea of what to expect, we'll first go over an overview of constant therapy clinician, and we'll go over the tasks screen. Then we'll look at a case study, and within that case study, we'll go over how to create a client account in Constant Therapy Clinician and how to customize a therapy program for this client profile. So this profile presents with mild to moderate impairments. Then we'll look at a second case study, and within that case study, we'll go over how clients can get started at home when their clinician creates an account for them in the clinic. We'll also go over the client experience using constant therapy as homework, and then some examples of exercises that are appropriate for someone with moderate to severe impairments. Then in a third case study, we'll go over how clients can get started at home when a clinician did not create an account for them in the clinic. We'll also go over how clinicians can connect these clients' accounts to manage the program going forward. And then finally, we'll return back to Constant Therapy Clinician, and we'll go over the robust reporting that is available to you. Constant Therapy has separate apps for clinicians and clients. Let's first take a look at the clinician app. If you're not a new clinician, your client list will appear here. If you haven't done so already, we recommend you first create a demo client so that you can get a feel for the app. Having unique usernames for each client means that you can personalize each client's program and assign the right exercises at the right difficulty level for homework. We're going to look at specific cases of different types of patients using Constant Therapy, but first I'm going to give you a tour around the Constant Therapy Clinician app. To use Constant Therapy in your sessions, pull up that client's username. You will access therapy exercises and customize your client's program from this screen. On the left is the complete library of over 80 exercises. Constant Therapy is used for many diagnoses like stroke, traumatic brain injury, and dementia, from mild to severe impairments, so there's exercises of all types and levels available. Tap on a skill folder and you will see all of the exercises that target that skill. Tap on an exercise to perform it with your client.
Fork.
You can find exercises in each folder, or you can also search by exercise name here. On the right-hand side is your client's therapy program. You can customize this based on their goals and ability level. We'll take a closer look at this later, but whatever you put on this list will be given to them when they use Constant Therapy as a home program. Clients can start using Constant Therapy with a clinician in their therapy sessions, or they can get started on their own at home. We'll go through both of these ways, but let's start with the former using a client example. So you have a client who you just evaled, and here are the scores from your evaluation. This person presents with mild impairments in auditory comprehension, reading, visuospatial processing, reasoning, and speech intelligibility. They also present with mild to moderate impairments in attention and memory. Keep this in mind as we go through the account creation process. Following the eval, you want to get them started using Constant Therapy in the clinic with you. Tap on Clients at the top left corner, then tap on Create New Client Account. Create a username and password for this person. We recommend you write this down because your client will log in with this information when they're ready to do homework. No need to worry, the password can always be reset if needed. Then you'll complete a brief profile. Select the diagnosis, time post-onset, and the skills you want to work on. If you recall from the evaluation, this person needs to work on listening, speaking, reading, and all of the cognitive areas. So based on the profile that we've selected, the program is suggesting some exercises that you might want to try with this client, but you can make any changes that you'd like. So if you want to try an exercise with them, you can simply tap on it, and here you can watch an instruction video, and then there's 2 ways you can customize the exercise for your client here. You can change the difficulty level and the item count. Since this person is more on the mild end, let's select difficulty level 10, and for demo purposes, let's just do an item count of 1. Then tap on Start. So this is a great exercise for selective attention. You might be working on scanning strategies or self-monitoring skills. If there are any incorrect responses, it will let you know with a shake. Then when they're ready, they can tap Done. I only selected 1 item for demo purposes, but however many repetitions you'd like to select, that patient will be given. Once the client finishes the number of repetitions you've selected, you'll get data on their accuracy. So let's say you'd like to remove this exercise from the homework and assign something harder for this client. That's no problem at all. Simply delete the exercise off of the homework. And if you recall, the library of exercises are to the left. Let's assign Find Alternating Symbols to the homework. Tap on the purple plus sign to add it. Now let's change the difficulty level to level 5 and the item count to 1. And we'll give it a try. So this is now building upon the previous task. Now they need to locate 2 different symbols as well as ignoring distractor symbols, and they have to remember what order they were in as well. Another example of how the tasks build upon each other is Find Alternating Words. Let's pop this over to the homework and do a difficulty level 1 and item count 1. I'm going to start with the uppercase word list, then switch to the lowercase word list, back to uppercase, back to lowercase, and so on. So this task might look familiar. It requires similar skills to the trail making bee task. It requires both selective and alternating attention, but also puts demands on planning, reasoning, and self-monitoring. Now this person is also working on memory. So let's look at one of the tasks the program has suggested, repeat a pattern. So since this person is more on the mild end, let's try a difficulty level of 6 in 1 item. If your client gets anything incorrect, then it will give them a visual and auditory cue that they did, and it will be accounted for in their score. Under visual memory, there's remember pictures in order, and let's pick level 3 and 1 item.
Tap when the picture is the same one you saw 3 pictures before.
This is a great working memory task. It works specifically on the skill of updating. So if you're working on internal memory strategies like visualization or rehearsal, this can be a really fantastic exercise to work on with those skills. There are 3 levels to this exercise. So level 1 is remembering pictures from 1 item ago, level 2 is 2 items ago, and then this level is 3 items ago. So it gets quite challenging. There's a lot of research that has looked at NBAC tasks with a variety of different diagnoses like mild traumatic brain injury as well as aphasia. And so you can see that there are 3 NBAC exercises in constant therapy: pictures, spoken words, and written words. And you can find them in both the attention and memory folders. So those are a couple of visual memory examples, but we also need to assign verbal memory exercises as well. I'll show you a couple of examples. Here is remember and say numbers. In this exercise, you have to remember number sequences like area codes and phone numbers. Let's do level 4 and an item count of 1.
1, 5, 5. 7, 2, 3, 3.
1, 5, 5, 7, 2, 3, 3.
Here's another example: alphabetize words you hear. We'll pick level 3 and 1 item.
Listen to the list of words: guitar, mailbox, panda, trophy, swing. Tap Start and say the words in alphabetical order.
Guitar, mailbox, panda, swing, trophy.
You got it!
Finally, there's other verbal memory tasks that don't require speaking. For example, here is follow spoken instructions level 5.
Place the microphone to the right of the watch before placing the basket above the watch. Then place the pigeon below the watch.
Now, to be sensitive to time, let's move on to a different cognitive domain like math and reasoning. So if you wanted to assign any math-based exercises, there's a number of exercises for that. Here's a great one: do everyday math. You have to do some complex calculations based on different functional materials. So you might see things like receipts, advertisements, W-2 forms, or check registers, so the client can solve that problem either on a calculator or on a notepad. Here's an example of an analytical reasoning exercise: read a map. Answer questions about functional maps like airports, cities, or subways. This is a great dual-purpose exercise for this client who also has mild reading comprehension impairments. Speaking of reading comprehension, another task to assign this client for homework might be read multiple paragraphs. In this exercise, set how many questions you want the client to answer, and the client will answer up to 5 questions per passage. In addition to impaired reading comprehension, this client also presents with mild impairments in auditory comprehension, and so you'd like to work on infer from voicemail in your sessions.
Hi Dad, it's Tim. Mom said you were having trouble with your iPad, so I was calling to see if you needed help. You should try plugging it into your computer and upgrading the software. If that doesn't work, I can come over and check it out. Talk to you soon.
You can always replay the voicemail if needed, or skip sentence by sentence. And then you can also use the drag bar as well to listen to specific parts again.
If that doesn't work, I can come over and check it out. Talk to you soon.
Your client will be asked up to 5 inference questions per voicemail. Finally, this client is working on speech intelligibility strategies for mild dysarthria. Earlier, we looked at some speaking tasks for memory, but there's many speaking tasks in there for people with aphasia, dysarthria, and apraxia. There's exercises from imitating words in a video, all the way to confrontation naming, to functional communication like saying the time or how much money. This client is practicing applying speech intelligibility strategies at the sentence level in structured practice. So I'm going to assign describe the picture for homework.
The boy rides a horse.
This person can get feedback about their loudness level and the clarity of their response. If marked incorrect, they can listen to their recording back. So through this example, we've gone over several ways to customize the client's program. To recap, you can add an exercise by hitting the purple plus sign. You can delete an exercise, change the order. Then you can tap on an exercise to change the level or the item count. Whatever you put on the right-hand side here will be given to your client when they sign in to do the homework on their own device. This is how you can use Constant Therapy Clinician in your therapy sessions and how you can pick and choose the right exercises for your client's program. There is a separate app for clients to use Constant Therapy at home to supplement your therapy sessions or to use after discharge from therapy. So now we're going to go through the client app, Constant Therapy, and we'll do this by looking at a different client profile. So here's the results from your second client's evaluation. This person presents with moderate to severe impairments in both language and cognitive areas. Keep this profile in mind as we go through the homework. So you got your client started in the clinic from your Constant Therapy Clinician account. You created a username and a password for them, and then you selected the exercises you want them to do at home. For your client to do homework, they will download Constant Therapy onto their own device, and that can be an Android or Apple smartphone or tablet, or a Kindle Fire HD. This client already has an account created by you, so they'll simply sign in with the username and password you created for them. Once they're logged in, they'll stay logged in, so they don't need to go through this process each time. When your client's ready, they'll hit start to do the exercises you've assigned. Now, in the first client example, we looked at some exercises for mild to moderate impairments. Now we'll look at some exercises for someone with moderate to severe impairments. This is understand words you hear at level 1. Clients will drag the picture that matches the word to the box.
Ice.
And if they get anything incorrect, it will give them feedback.
Comb.
If they need to hear the word again, they can take a cue.
Comb.
All responses and cues are recorded for the clinician in reports. After each exercise, your client will get feedback to keep them motivated, and they'll have an option to take a break or continue doing therapy. So this exercise might look familiar. We used Find the Same Symbols level 10 for the first client example. Now we're seeing it at level 1, so there's quite a range of difficulty levels in the app. This word retrieval exercise asks semantic features about the picture.
Is this a fruit?
Here's Understand Stories You Hear at level 1. This level gives you short 2-sentence stories like this.
Molly is going to study abroad. She is going to Singapore.
For each level, the content gets longer and more complex. For example, level 6 has stories over a minute long, so it's great for both auditory comprehension and memory skills. Here's a picture spelling exercise. The great thing about these exercises is that there's a number of cues. Tap on the sound icon to hear the word,
Clock.
or tap on the letter tiles to hear the sound. Finally, if there's any motor issues where the client can't drag items to the box, they can always tap on the item and then tap on the box instead.
Clock.
We looked at a sentence level speaking task earlier. Now let's look at a confrontation naming one.
Cup.
Just like in the clinic, there's cues your client can take. Semantic,
It's a piece of furniture.
phonemic,
Be.
graphemic, and whole word repetition.
Bed.
Bed.
Like all cues in the app, these are being recorded for you in the report section. Okay, the last task we'll look at is put the steps in order. It's a great functional task for reading and executive functioning. If you get anything wrong, it won't allow you to place it. But if you do make errors, it will be incorporated into that score. At the end of the homework schedule, your client will get feedback. So now I'd like to take a moment to talk about the Neuro Performance Engine, or the NPE. This is the algorithm that is here to support the client as they progress. When clients do homework, the NPE is monitoring how the client is performing, and if any of the exercises are too easy or too hard, it will adjust the difficulty level or the exercise type. That way, between sessions, the client will continue to have fresh, continuous exercises at the right level instead of having to wait until the next session for the clinician to give them new homework. This also allows clients to continue to practice once they're discharged from therapy. Clinicians can always choose to turn the NPE off if you want to be the only one managing their homework, and I'll show you how to do that shortly. Before we move on from the client app, there's one more important thing for clinicians to know. In the example I just showed, the client's account was first created by the clinician, so that client just had to sign in with the username and password the clinician created. But some clients get started independent from the clinician. They either found Constant Therapy on their own, online, or in the App Store, or their clinician told them to just go home and sign up and get started on their own. When that happens, clients will download the app on their device, but then they're going to select Start a Free Trial.
Welcome to Constant Therapy. Let's figure out a plan together.
Because a clinician has not created a homework program for them, we will help them get started. After they create a username and a password, your client will identify what skills they want to work on. We will then guide them through a brief assessment in each of the skills they selected, starting with one skill area and adding more over time to build their therapy program. Here's an example of the brief assessment. There's two parts: a patient-reported outcome measure and objective questions. The patient-reported outcome measure asks questions like,
In the last week, how well could you read words?
or
In the last week, how well could you read multiple paragraphs?
to help us understand where the client feels like they're breaking down. And you can see that the questions are multimodality with auditory, written, and visual support. After answering a few of these questions, they'll be given an objective measure, which increases in difficulty level until we figured out the right place to start. Once we know where to start, the client will get therapy exercises in that assessed area. And also, the other skill area assessments will be added in over the next several sessions. Once all the selected skills are assessed, they will then have the same homework experience as the clients who got started in the clinic with their clinician. Also, if clients want to work on other skills they didn't initially select, they also have that option. There's one last thing I want to point out in the client app. You might have a client who wants to have more control over their program. For these clients, they can access the same controls as your clinician app by tapping on Settings, Therapy Settings, and selecting Self-Guided Mode. Their screen switches to the same screen you see in your Constant Therapy clinician app. So clients can pick and choose the exercises they want to work on or access reports here. One important thing to note is that the NPE does not run in this mode. So clients' exercises will not be automatically updated from here. We recommend that they make the changes they want to their program here, but then they tap Exit to return to their welcome screen to actually do the therapy exercises. Now, for these clients who got started using Constant Therapy on their own, if they are working with a clinician, that clinician can link their accounts together and manage it going forward. So we're going to go back to the Constant Therapy Clinician app. And to link accounts with this client, you will select Connect to a Client Account and enter in your client's username and password. Then you can make adjustments to the program, use Constant Therapy in the clinic with them, and view their progress. I'm going to show you 2 more things in your Constant Therapy Clinician app. First is Therapy Settings. Remember the NPE that makes adjustments to your client's homework? You can choose to turn this off here. Then their homework will not update unless you make a change. Finally, here is the Report section. This Summary tab is great to get a quick overview of your client's performance. Here you can see all the exercises that the client has completed, see history of all the homework and clinic sessions completed, and you can tap on the different sessions to see their performance over time. And also you can view therapy compliance with this calendar. You can see when they used Constant Therapy in the clinic or at home, as well as how many items and how many minutes of therapy that was done. This gives you some great information about the intensity and frequency of practice. Tap on the Progress Note button to see the baseline and latest scores for each exercise. Here you can see accuracy, latency, and cues. You can also save yourself documentation time by emailing this report to yourself and then pasting it into the medical record. Finally, on tablets, you can also tap on the detailed report at the bottom right of the screen. This comprehensive table shows you the accuracy scores for completed exercises. You can get some really valuable information from this table. For example, if a person's score is much lower at home than in the clinic, you can dig into this for reasons why. Maybe they aren't carrying over the strategies you're training in the clinic, or maybe there's a difference in their home environment that's impacting their abilities. You can also track latency scores and see how that's interacting with accuracy. Finally, you can tap on a score to see a bar graph of the accuracy and speed of each item completed. Tap on the bar graphs to view a screenshot of each item. Constant Therapy Clinician has a clinician dashboard on our website for you. You can go to thelearningcorp.com, select Constant Therapy from the menu, and then My Account. Sign in with your clinician username. Here you can view your entire caseload at a glance. You'll get a valuable overview of client performance and activity. Click on View Performance to see an in-depth progress report for each client. Here you can see your client's progress through each domain and progress through specific exercises. These bar graphs can be great ways to give your clients feedback in the sessions. So here's one example of ADD Level 2 where they're now at 100% and they're also significantly faster than their baseline. So it looks like they're on track and perhaps ready to do ADD Level 3. Here's another example of Do Clock Math Level 1. It looks like there's a decline in both accuracy and latency. So that might prompt you to dig in a little deeper into the task and see what's going on, and perhaps there might be some strategies that can be trained in order to improve the score. Here's one last example. This is mental rotation. This person is showing improvement. They're now at 80%, although it looks like they're slowing down. But maybe that's intentional and it's one of the self-monitoring strategies that you're training to slow down. So this can be a really nice teaching opportunity to show how they are slowing down, but look how the score is improving. So this wraps up the demo portion of the webinar, and we're now going to answer some frequently asked questions to finish up. So the first question, is Constant Therapy HIPAA compliant? The answer is yes. Does the app need Wi-Fi? Wi-Fi is certainly the recommended way to use the program. You can also use Constant Therapy on a data plan, or a hotspot? Can multiple clinicians be linked to a client account? The answer is yes, and this happens often. Perhaps there's two speech pathologists who share a client, or maybe a speech pathologist and an occupational therapist both work with the same patient. That second clinician can just go onto their Constant Therapy clinician account and open up their Clients tab and select Connect to a Client account. Can clients create a client account on their own independent from a clinician? They absolutely can, and that we looked at in that third client case study. So if you want a refresher on how they can do that and what that experience is, take a look at that third case study that we went over during the demo. But when they do create an account independent from a clinician, they'll get some assessments to figure out the right level to start the client at. And that clinician can always link to them at a later time. And when that happens, the clinician can take over and manage their account going forward. What devices can be used with Constant Therapy and Constant Therapy Clinician? So both programs are available on smartphones and tablets, and that's iPads, iPhones, Android tablets, Android phones, and Kindle Fire HD. Can Constant Therapy be used on the computer? So at this time, Constant Therapy is only available on mobile devices, so that's smartphones and tablets. There are reports available online on the computer. So both clients and clinicians can go to thelearningcorp.com, sign into their account, and they can access detailed reports about their performance. What if my client started their 14-day trial, but they didn't have much opportunity to practice? If that's the case, then your client or their family member or you as their clinician can contact us. So if they haven't had a chance to log on and they haven't done too many exercises, we can look into that and work with them to extend it a little bit so that they can try it. Next question, how do I discharge a client from my clinician account? You'll just open up your client list and there's a minus sign next to each of your client names. So you can just tap on that minus sign and remove the client from your account. If that client is using Constant Therapy at home and they're doing the home program, when you remove that client from your clinician list, you won't be removing that person's account permanently. You'll just be unlinking yourself from them. And if they ever come back to you, you can just add them again to your client list and pick up where you left off. What happens if my client has issues like logging in or connecting to Wi-Fi at home? Constant Therapy has a great support team that's available for your clients, their family members, and for you. So if there's any issues outside of the clinic, they can just contact us. How do you know what new exercises are being added to Constant Therapy? So that's a great question. We first recommend that you set your device to have automatic app updates. So if this is turned on, that means that any new features or updated exercises or new exercises will be automatically delivered to you. Also, if you opt in for email notifications, then you'll get those alerts over email as well. When the client does homework, when do the tasks or levels change? So the NPE will make adjustments based on your client's performance. And so what it's looking for is some consistency in their performance. And so each of the exercises have a scoring algorithm in order to move them up or down in level. Do homework tasks need to be removed by a clinician? If your clinician account is linked to the client's, the clinician can make any adjustments to the homework at any time. If that NPE is turned on, then the homework will be adjusted as well. And so if the clinician removes something from the homework, that NPE will kind of take that into account and follow that clinician's recommendations. Is the automatic homework update always on unless I turn it off? Yes, the default is that automatic homework update or that the NPE is turned on. So that's there to support the clinician and make sure that the client is getting things at the right difficulty level and has a fresh program. But you can go in and just simply turn that off if you choose. Are incorrect responses factored into the client score? Yes, so all incorrect responses are incorporated into the accuracy. And again, latency is also being recorded as well. So many of the exercises take both of those as well as cues into account. The next question is, do you have any tips for getting clients started with Constant Therapy as a home program? If you're able to observe how clients do the homework in your session, this would be the most ideal way to get them started. And this recommendation is really for any sort of homework that you assign, not just Constant Therapy. If your clients can bring the device they wish to use, you can do a skilled observation of them going through the homework exercises. And this can be really important to do in the sessions because it helps you see what doing the work will be like when they don't have a clinician involved. And so that can promote better carryover at home. So, did they need prompts to get the tablet or phone out and open up the right app? Maybe you need to target this skill in your therapy sessions or provide recommendations to the family member to help with setting up the device before they get started with the homework. So, you'd be giving a similar type of recommendation that you would do for dysphagia, like if a patient is independent with their swallow strategies except for meal setup, and you need to educate the caregiver to help with that piece. Since they'll be doing the homework independently and you won't be providing cues, are they able to do the exercises successfully? Or do you need to drop them down in level? Also, how long is it taking them? If it's taking them a lot longer to do on their own than in the therapy sessions, perhaps you limit the number of items, the number of exercises, or the length of time that they do it. How much time do you want them to be working on it? Constant Therapy can have a long list of exercises if you want, but that doesn't mean that the client needs to finish it in one sitting. You can also build external strategies to make them more successful in incorporating this into their routine. Executive functioning strategies are particularly good for our cognitive patients, but you can also use them with our speech and language patients as well to help build good homework habits. You can use their daily planner or their electronic calendar to look at their schedule and ask them, when are they going to work on Constant Therapy? Given what else is on your schedule, what is realistic for you to do that week and for how long? And then let's schedule these sessions into your calendar. What electronic alerts can we use to remind you? Does your calendar have an alert? Do we want to use something else like a reminders app to help you to remember to do your homework? And then especially with your TBI patients, you might also want to consider symptom management if the client is dealing with things like headaches or sensitivity to light or sound. So be sure to talk about monitoring these symptoms or perhaps scheduling shorter but more frequent sessions so that they're not trying to do everything all at once. And then also, what time of day will they be working on Constant Therapy? This can also impact function and scores if they're really fatigued, so perhaps you give them recommendations about what time of day they should be using it. And the final question, do you have any videos to review this information? Yes, there are lots of videos available for both clients and clinicians. If you go on our website, under clinicians, there is a section for how-to videos that breaks it down into different topics. There is an overview video as well as others that are under 2 minutes that go deeper into these different areas of the program for you. There's also how-to videos for clients as well, things like how to turn on your device or how to connect to Wi-Fi. So be sure to check out our website for all of these materials. So this concludes the course, Constant Therapy, a complete guide to implementing clinical practice. I'd like to thank you so much for your time today. And if you have any questions, comments, or feedback, please contact us at support@constanttherapy.com.